Welcome back to Inside South Florida. May is Stroke Awareness Month, so how do you recognize the signs and symptoms of a stroke, and what do you do if you or a loved one is having one? Here is Dr. Ritesh Kaushal. Dr. Kaushal, good to see you. Welcome back to the show.
No, thanks for having me, Dave.
It's been a while, but it's important to talk about May is Stroke Awareness Month, obviously. And what's so interesting now is that the research is showing that more and more younger people are having strokes. Why do you think that is?
Well, so stroke essentially is a block in one of the main blood vessels in the brain. We have numerous risk factors tied up towards having stroke. As we've evolved over the past few years, we've actually gotten a good handle on a lot of these risk factors. We've reduced smoking dramatically, we've reduced hypertension, but there are other factors which are not completely known, mainly genetic factors, factors that lead to a certain arrhythmia in the heart called atrial fibrillation. And these are the factors that happen in younger patients. So as we control all the risk factors towards the older age group, unfortunately we're seeing more and more of the younger patients now having stroke.
So not to get too far off topic, because there's a lot to talk about, but you mentioned AFib. Is that something that a younger viewer right now watching the show might be able to detect? Would they have a palpitation? Is there any way to know that you might be at risk?
Unfortunately, yes and no. I mean, there are some people who actually do feel the palpitations, and it's always for a younger person who has palpitations quite often. I mean, it's very important for them to get checked up. But really speaking, no. I mean, AFib is a silent killer. Many times in atrial fibrillation, you would actually form a clot in the heart in 20 minutes, which can go up to the brain and cause a stroke. So it can happen very, very suddenly, just out of the blue. And the main thing is you might not have AFib all the time. So that's why we call it paroxysmal AFib. You might have it one day, you might not have it for another 2 months, and then again you might have it for a little bit.
All right, well, if you think that you might have had a stroke, if you think a family member might have had one, don't even mess around, right? Get someone to a hospital quickly, because time is the most important thing.
Absolutely. I mean, the adage time is brain is completely true. I mean, we lose about 2 million brain cells and neurons in a stroke every minute. So one of the most important things, if anything that can make the biggest change in terms of us having good handle in stroke care, it would be the time aspect of it. And call 911 immediately. The best thing is the FAST, if you can remember that mnemonic, which is face, arm, speech, and time. So any facial droop, any arm drift, any weakness in the arm, any speech problems, and then lastly, time. So immediately call 911 and come to the closest center.
And if they end up at Palmetto General, where you are, you have a comprehensive stroke center. What does that mean?
So comprehensive stroke center is basically the highest level of stroke care. Essentially what we do is we can take care of all the basic things of stroke, including giving IV TPA. But in addition to that, we can actually go up physically. We go in through a catheter from the groin, and we go up all the way up into the brain, into the vessel which has the block, and we can physically pull the clot out. So that beyond that, we also have advanced neurocritical care team. It's a multidisciplinary approach where numerous physicians with numerous specialities are involved, and we all come together to take care of the patient. So it's the highest level of care that's possible.
Well, hopefully none of our viewers will ever have to see you for that reason, but if anyone has a question, how can they find you?
Palmetto General Hospital, the website has good information about how you can get access to any one of us. But beyond that also, I mean, the best thing is just call 911, like I said. In emergencies, they will take you to the closest comprehensive stroke center. And that's what you want, I mean, the adequate stroke care.
Okay, and as we say goodbye, hypertension, blood pressure, I guess that is the same thing, smoking, anything else that we need to make sure we're aware of?
Diabetes, again, dyslipidemia, cholesterol, the same risk factors that are risk factors for a heart attack are similar risk factors for stroke as well.
All right.
And so those are the modifiable risk factors. Unfortunately, the non-modifiable risk factors is what we worry about more now.
Well, good to see you, and we'll see you again soon.
No, absolutely.
All
Thanks
right,
for having
take
me.
care.
It's a pleasure.
You got it.
Thanks.